This has been approved by the government just last week, and it's been announced today. Perhaps a good day for good news after the hammering the government's taken in recent days over care homes and the general the way they've conducted themselves over the care home scandal. So this, yes, has been described as a game changer by Boris Johnson. It's been developed by the Swiss company Roche, and it's been tested in the government's secret or not so secret medical facility, science facility, Porton Down. Now, we know that it's a blood test. We know that it's a laboratory-based test. Roche says it can provide thousands of these lab-based tests to the NHS each week. But the real question on that is whether it can be mass-produced and how much it costs. That's something the government is going to look at. As I say, hopes are high. The government says it's going to make an announcement, a further announcement, when it's ready to do so.
We know that some tests that we've talked about in the past have had problems with reliability, lots of people getting false positives or even false negatives. How reliable is this new antibody test?
Well, let me tell you again how it works. So it's a blood test. It shows if the patient has been exposed to the virus and if the patient has antibodies. And if the patient does have antibodies, there are hopes that that means an immunity of up to 2 to 3 years, which is key, of course, in easing lockdown restrictions and crucially in sending people back to work, particularly key workers, health workers, those on the front line. So hopes are high, but as you mentioned, the World Health Organization has cast doubt on whether people actually ever become immune to this virus. There are so many strains out there. We know of at least 5, and we know that people have had tests showing that they do not have immunity. That could be because of false positives. It could be because of a different strain. It could be because a patient has the virus but has it only mildly so that they can get it again. So all these are things that are going to have to be looked at. But the hope is high, the hope that it will provide a patient with immunity passports, and that could go away to easing lockdown restrictions. And of course, the other side of this is it could show a better picture as to the UK's coronavirus spread, to show how many people have actually had it, which could again go a long way to changing things in this country about people going back to work, about the economy getting slowly, steadily back on its feet. So the government has said there have been false hopes before, but it is hopeful about this one. It will announce further decisions on whether the test will be rolled out, if it's affordable enough to do so, when it's ready to do that.
35,000 selected households and 60,000 samples to know exactly how spread the disease was in Spain, and the preliminary results have been welcomed with quite shocking for the Spanish people, because only 5% of the population, 10% in the most affected areas like Madrid and the neighboring provinces have been affected by the virus, and that means that Spain is far away from that immunity, herd immunity that we were looking after, and we also have these very difficult and problematic figures that after 25 or 27,000 deaths, only 5% of the population had contact with the virus. That it gives you a fatality rate of more than 1% in Spain. The good news is that the lockdown worked, that the lockdown managed to stop the spread of the disease, but now is raising a lot of concerns regarding how are we going to ease this lockdown